Delirium is a severe acute decline or fluctuation in attention, awareness, or other cognitive function, leading to serious adverse outcomes. Despite its severity, delirium is frequently unrecognized and uncoded in patients' electronic health records, EHRs, due to its transient and diverse nature. Delirium affects 1,115% of hospitalized older patients, with another 2,931% developing incident delirium during hospital stays. This condition is associated with higher likelihood of hospital mortality, increased length of hospital stays, and greater risk of one-year mortality after discharge. To address the challenges in identifying delirium, researchers have employed natural language processing (NLP) methods to extract symptoms from clinical notes. A recent study developed an expert annotated delirium corpus and compared the performance of 5 state-of-the-art transformer models, including BERT, RoBERTa, BERT_mimic, RoBERTa_mimic, and Gatortron. Gatortron achieved the best strict and lenient F1 scores of 0.8055 and 0.8759, respectively. Identifying symptoms of delirium is a clinical concept extraction task, which involves recognizing concepts of important clinical meaning from clinical narratives. Previous approaches have included both rule-based and machine learning-based solutions. Rule-based solutions recognize concepts with fixed patterns, while machine learning-based solutions learn patterns from annotated data. The development of a computable phenotype for delirium using NLP can improve diagnosis methods and inform clinicians of the effectiveness of interventions. The use of NLP in delirium diagnosis is crucial, as it can facilitate real-time identification of symptoms. The transient nature of delirium and the difficulty in its identification make it challenging to diagnose. However, NLP systems can help address this challenge by analyzing clinical notes and identifying symptoms of delirium. The study's findings highlight the potential of NLP in improving delirium diagnosis and patient outcomes. Clinical natural language processing systems have been developed to extract general clinical concepts from clinical narratives, leveraging recent advances in deep learning-based large language models trained using transformer architecture. These models have achieved state-of-the-art performance in various NLP tasks, including name identity recognition, relation extraction, natural language inference, and question answering. Specifically, bidirectional encoder representations from transformers, or BERT, has enabled transfer learning ability, allowing one model to be applied to many NLP tasks. Previous studies have applied NLP in delirium diagnosis and outcomes, including sentiment detection from radiology reports, identifying delirium patients from electronic health records, and analyzing delirium within COVID-19 patients. However, a significant gap remains in systematically identifying and categorizing delirium symptoms from clinical narratives. To address this gap, the authors developed annotation guidelines and a corpus, and then explored 5 transformer-based large language models BERT, BERT_mimic, RoBERTa, RoBERTa_mimic, and Gatortron to develop an LLM-based delirium symptom extraction NLP system. The authors extracted patient electronic health record data from the University of Florida Health Integrated Data Repository, containing over 2 billion observational facts pertaining to more than 2 million patients. A cohort of 170,868 patients was identified using specific criteria, including adults admitted to medical or surgical units at UF health hospitals from 2012 to 2021. The demographics of the cohort are presented, showcasing the mean age, sex, race, ethnicity, and other characteristics. This study aims to develop an NLP system to extract delirium symptoms from clinical narratives, laying the foundation for the future development of computable phenotypes and diagnosis methods for delirium. By leveraging advanced NLP methods, this research seeks to improve delirium diagnosis and patient outcomes. The demographics of the study's cohort are presented in Table 1, revealing an average age of 56.8 years, with a slight majority of male patients and a predominantly non-Hispanic white population. A total of 6.9 million clinical notes were identified, and a snowball sampling strategy was employed to curate a set of keywords related to delirium symptoms. This involved iteratively reviewing batches of notes to identify new keywords, resulting in a list of 45 keywords. These keywords were then used to filter the notes and identify those with at least 3 delirium keywords, from which 600 notes were randomly selected for annotation. An expert panel of NLP researchers, clinical researchers, and practicing nurses developed annotation guidelines for delirium signs and symptoms, categorizing them into 8 categories: disturbed attention, disturbed perception, psychomotor activity, fluctuations, memory deficit, consciousness level, disturbed sleep, and disorganized thinking. An other category was also included to capture cases not covered by the guidelines. The categories were based on the diagnostic criteria described in the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSMV. 3 annotators were trained to manually review the 600 notes and identify the delirium symptoms, with annotation agreement monitored and discrepancies discussed in expert panel meetings. The annotation guidelines were improved as necessary to cover new cases and resolve discrepancies. The delirium symptom extraction task was approached as a clinical concept extraction or name identity recognition problem, to be addressed using transformer models. Researchers developed a deep learning model to extract delirium symptoms from clinical notes, leveraging transformer models in both general and clinical domains. The task involved identifying and classifying delirium symptoms in a dataset of clinical notes, using the standard bio-annotation format. A preprocessing pipeline was applied to perform tokenization, sentence boundary detection, and bio-format transformation. 5 pre-trained language models were utilized, including 2 general English domain models BERT and RoBERTa and 3 clinical domain models BERT_mimic, RoBERTa_mimic, and Gatortron. These models were fine-tuned with clinical text from the Mimic3 database and evaluated on a test set of 110 notes. The annotation process involved excluding 54 duplicated or invalid notes, resulting in a total of 2,496 concepts for 8 categories of delirium symptoms across 546 clinical notes. Annotation agreement among 3 annotators improved from 29.2% to 97.1% across different batches, with all notes being annotated independently by at least 2 annotators. The dataset statistics are presented in Table 2. The experiment and evaluation process involved training the models using a training set of 381 notes and monitoring performance with a development set of 55 notes. The best model for each transformer was selected based on validation performance on the development set. The delirium symptom extraction system was evaluated on both strict and lenient precision, recall, and F1 score, providing a comprehensive assessment of its performance. Delirium symptom concepts are analyzed, and the performance of 5 transformer models for delirium symptom extraction is evaluated. The distribution of delirium symptom concepts across the training, development, and test sets is presented in Table 2. Psychomotor activity, disturbed attention, and consciousness level are the top 3 most frequently mentioned categories. Notably, the training set has a higher proportion of attention-disturbed concepts, psychomotor activity concepts, and fluctuation concepts compared to the development and test sets. The performance of the 5 transformer models is compared in Table 3. Gatortron achieves the best strict and lenient F1 scores of 0.8055 and 0.8759, respectively, closely followed by BERT_mimic. RoBERTa achieves the best recall. Clinical transformer models, except RoBERTa_mimic, outperform general transformer models on strict F1 score. Gatortron's performance on different delirium symptoms is presented in Table 4. It achieves excellent extraction performance on consciousness level and disturbed sleep with strict F1 scores above 0.9. For most symptoms, Gatortron demonstrates good performance with strict F1 scores between 0.73 and 0.88. Overall, the results suggest that Gatortron is the most effective model for delirium symptom extraction, particularly for consciousness level and disturbed sleep. This study aimed to identify and categorize delirium symptoms from clinical narratives, a crucial step in diagnosis and phenotyping. To achieve this, the research team created a corpus of delirium symptoms and evaluated 5 transformer-based NLP models for extracting these symptoms from clinical narratives. The Gatortron model demonstrated superior performance, achieving the highest strict and lenient F1 scores of 0.8055 and 0.8759, respectively, outperforming general-purpose transformers trained on General English text. The analysis revealed that all transformers performed well in identifying memory deficit, consciousness level, and disturbed sleep symptoms but struggled with disorganized thinking symptoms. An error analysis and confusion matrix for the Gator-Tron model showed that most errors in identifying disorganized thinking stemmed from false negatives. This category includes complex situations such as irrelevant conversation, a large amount of non-essential information, unclear or illogical flow of ideas, unpredictable switching from subject to subject, mumbling, incoherent, illogical, and rambling. The lack of mentions in the training set, 2.22% of all concepts, significantly impacted the performance of the clinical NLP system, particularly for symptoms with simpler situations like disturbed sleep and fluctuation. This highlights the importance of comprehensive and diverse training datasets in improving the accuracy of clinical NLP systems, especially when dealing with complex symptom categories like disorganized thinking. Delirium symptom extraction from clinical notes poses significant challenges due to context and intent ambiguity, as well as the need to differentiate between clinical judgment and potential risks. To address these challenges, this study categorizes detailed delirium symptoms into 8 distinct categories, providing a more comprehensive understanding of the disease's progression. State-of-the-art clinical transformer models are applied to ensure accurate extraction of delirium symptoms from clinical notes using natural language processing techniques. This approach enables the capture of nuanced information about delirium symptoms, which is critical for efficient diagnosis and treatment. The extracted delirium symptoms have the potential to be used for computable phenotyping of delirium, a crucial step towards developing more accurate and efficient diagnosis methods. Future work will explore the application of NLP-extracted delirium symptoms in this context. This study was supported by grants from the National Institutes of Health, National Institute on Aging, and other institutions, highlighting the importance of continued research in this area. By developing more accurate and efficient methods for delirium symptom extraction and diagnosis, this research has the potential to significantly improve patient outcomes and healthcare resource allocation. Please provide the original transcript or research paper content that needs to be refined. I'll follow the guidelines to create a concise, technically accurate summary suitable for voiceover narration. Delirium, a common and serious condition characterized by acute disturbances in attention, awareness, and cognition, often goes undetected in clinical settings. A study by Lang et al. 2019 investigated the prevalence of undiagnosed delirium in a tertiary hospital, employing a cross-sectional design and the confusion assessment method, CAM, to diagnose delirium and identify potential predictors. The results revealed that undiagnosed delirium was frequent, affecting approximately 33% of the sample population, with only 12% of patients with delirium having been previously diagnosed. Several risk factors associated with undiagnosed delirium were identified, including age, cognitive impairment, and comorbidities. The high frequency of undiagnosed delirium highlights the importance of systematic screening and assessment tools, such as the CAM, to facilitate early detection and intervention. These results have significant implications for healthcare professionals, policymakers, and researchers, underscoring the need for enhanced delirium awareness and education. The study's findings reinforce the importance of addressing delirium as a critical aspect of patient care, particularly in high-risk populations. Furthermore, they underscore the need for further research into delirium pathophysiology, risk factor identification, and effective management strategies to improve patient outcomes. The development of improved delirium detection and management strategies is crucial to addressing the significant burden of undiagnosed delirium in clinical practice.